Hi, Rachel. How are you?
Dr. Smith, I'm well, thank you.
It's so good to see you today. And thank you for doing this interview with me. If we could call it an interview, it's really just a chat to share a little about your experience. And in case people are wondering, my name is Claire Smith, known also as Dr. Claire or Dr. Smith. And I am a spiritual mentor and coach working with people to manage the tension between their personal and professional lives so that they can have clarity and live with confidence, deepening their relationship with God, themselves, and others. And so Rachel is a client of mine. And if you could say a little about yourself before we talk about working with me.
Sure. I am a psychotherapist, licensed in 3 states. So I'm pretty busy. And I'm a wife. I have a husband of, at this point, 3 years. It feels like longer. Um, I'm a daughter. I've got two amazing parents, and I've got a brother, a year older than me. But in terms of just life is super busy. I've got a few businesses, and so cultivating two newer businesses, and then my therapy practice has some years behind it, and it kind of feels like mostly autopilot these days. So my husband and I have navigated into some new spaces. So we have, well, I have identified that I really need space to be able to process all of the different moving parts, which is where Dr. Smith has come in.
Yeah. And it's always a joy. I chuckle as you talk about the different moving parts because I feel it's always an adventure from the first time I met you. But what I do know is that you're always very competent, very organized. So that's great. So you kind of went there a little, but let's think about the first time we worked together. Because in many ways, you're an ongoing client of mine.
That's true.
You're not involved in any specific program I'm doing, though I have those, but you just, you've been with me a couple of years. So talk about the first time you came and what may have prompted that.
Um, it was just moving into a direction where I felt just weighed down. Like it was just there were so many things going on at once. And then the thing you had said just in some conversation was clarity, right? So the thing that really drew me was that Christian perspective. I am a child of Christ, and I just need someone that I can trust give me sagacious wisdom that's also biblical. So the first time, there was just so much going on. I mean, business stuff, navigating, into, and I can't remember. I feel like we started this work after I got married. Um,
That's
do
the
you mean,
ongoing part. We
okay,
did
so
have
you mean back in St. Paul?
no, the very first time I think you were still studying or you just started your practice. And then there was a gap and then you came back.
Okay, thank
But
you.
if you can't go that far back, that's fine. We don't have to.
No, I can't. I remember. Okay, so I remember. I guess I was talking about the reinitiation.
Right. And that's fine.
Okay, but no, back was, yes. I do remember that time. I was working for a community-based clinic, and
Mhm, that
it
was it.
was exhausting. I mean, they give you these huge caseloads to manage, and I was just like, this, I can't just continue this way of navigating in terms of being bogged down and having nothing left by the end of it. Um, so I was starting a new practice, and it's really been a God thing in terms of just felt so organic. And so at that time, reaching out to you and connecting and getting clarity in what operations, like what am I doing? What is the goal? Is it sustainable? And again, what is the goal? Just you kept the target in front of us as to what are we doing and what is the purpose? And are you
Yeah.
acting in ways in alignment with that? And so that was the first time. And then there was some space, and life happens. I meet my husband, practice is going well. We reinitiate because now I'm in a marriage. And then my brain told me when you unite with someone, things should be less because there are two of you to divide and conquer. It was not that way. There are even more things, and we have to sift through all the things. And so we were doing that. He is wonderful, but I'm probably the more business side, and he's the more like the muscle. He's the getter done, and I can count on him to get it done for sure. But when it's like business stuff, he's like, "You got it." So trying to figure out how I navigate my part, and then his part, and then exploring with you, like, where are ways where you step out and you allow space for him to step in, and where are ways where you think about the higher goal versus what your feelings and your thoughts say, and what's biblical there.
Yeah. Mm-hmm. It's kind of funny in some funny and the other funny as well, funny peculiar, though not so much a peculiar, because even though my work is not about marriage, I still end up with people saying it helps them in that area. Because I would say I'm about connections, because at heart, I'm a connector. I love connecting people with God, or seeing people connected with God, seeing people connected with each other, and putting different things together. So I always get a little chuckle when somebody brings in that part of it. What would you say your experience has been like working with me?
Positive. I will be honest. When I first saw the opportunity, when I was in the cloud of stuff, I was like, I'll try it. I don't feel like I really need it. And then when I got, I think you called it like a clarity session or something.
Yeah.
And it really, for me, helped me take off some of the extra just layers that didn't need to be there. And really it was clarity in, okay, what is something that I want to focus on, and then what's getting in the way. And so, yeah, I would say that.
And again, I mentioned, interesting, fascinating. Sometimes I use those words and I think I'm using them again. It's fascinating to me because you are a therapist, licensed. You can say what your official title is. I know you said it at the beginning, but you are into clarity counseling, and yet you're working with me. So some people might wonder, how is that? So maybe you can help them understand that. What makes this different?
Excellent question. Yeah, so my practice is called clarity counseling. And I do it for people all day from a clinical perspective, right? So I'm dealing with people that have challenges as related to behavioral health concern. And when you think about just clarity, especially for me, I'm Christian, and so it needs to come from the core source. Intellect is great, but for me, it has to align with biblical and the intellect, because God made wisdom and intellect. And so, for example, I'll show you really quickly. I show clients at usually our second session. I will show them this, and it's showing backwards, but it's basically the cognitive.
I'm seeing it fine. Yeah.
Okay, it's the cognitive behavioral triangle, where your thoughts, feelings, and behaviors all align. And so for clinicians, even though you're a therapist, you still need space to process, because you're always in someone else's environment in life and space. And so you need to step out and then think about, okay, what part is mine? What part is theirs? And then the other part is, what are my own goals? Because I can't be so wrapped up in the work where I'm not focusing on the things that I want for me. And so that's why the clarity part is really important. As a professional, especially as one in the behavioral health field, it's just really nice to have someone give you or provide space for that, help you develop it.
Mm-hmm. And if somebody were to ask you what's the difference between therapy and coaching, what would you say?
Probably training is different, right? So it's clinical. So you're being trained on mostly a medical model. You're looking for symptoms and then you're looking for treatment. Coaching is you're laying out for people the whole roadmap, and then you're saying, okay, if this is the goal, how do we get there? How do we remove barriers? There's some overlap for sure, but
Yeah.
I think for coaching, you can't have a need for, I guess, mental health purposes and go to coaching. That's not going to be the fix.
Right.
But the other part is if I get someone in office and I'm doing their assessments and I say, okay, I know you're having challenges, but I don't see you register as a need as a mental health disorder. You probably should look at a coach or some orientation there because you need clarity in some things, right? So there's different acuities and different reasons for why you would choose.
Yeah. And, I have clients who do both, right? I have a client who, because of our work together, she realized she needed a therapist. And then I might have clients who are seeing therapists, but there's something more specific, especially when it comes to the programs I do. Like one of my programs right now is Pathway to Clarity, your guide to navigating complex changes with confidence, hope, and love. And so the coaching could trigger a recognition of the need for therapy. And also, if people are doing therapy, they may see something specific in what I'm doing that they want to address. So I think it's great that the professions can complement each other, right? Because we don't, we come at issues from different perspectives, and based on where people are and what they need, they can choose either or both. And that's wonderful that we can have this relationship. If you were to give, I know we've touched on it throughout, but if you were to sum up and give one or two benefits from working with me, putting it in one place. You've mentioned clarity before, but if you were to say it, like somebody said, what's your biggest benefit? And then what's your second biggest benefit? What would you say?
I mean, I would have to go with the clarity thing as my biggest benefit, but I'm going to go also to accountability. I know that I've got a call with Dr. Smith and she's going to ask me on the goals that we said we worked on. And I need to have some type of answer, or I'm going to say, okay, didn't do that. Thank you for reminding me. and then Dr. Smith.
That has happened.
Yeah. That accountability piece is everything. And I would like to add like a part 2B, having that space for myself. Really creating space, because I think professionals don't always do a great job at it. My husband even asked me recently, he was just like, yeah, when you had a call with your lady, doctor, you couldn't remember her name, right? But he's like, you have a call. I was like, yeah, not, it's not coming up currently, but yes, we've got some calls we've got to get scheduled. In terms of thinking about space for myself, that is a need for me.
Yeah. I'm laughing because I have another client. She's not working with me right now, but she's worked with me a few times. And her husband calls me your lady or something like that when it's time for us to have sessions. It's just funny to me how the husbands kind of look at things. But he's supportive of it like yours, right? They're like, have you had your session yet? That type of deal.
So I'll come in typically, like after we meet, like one time you were asking me about health goals. And I said, okay, well, so we're doing that. And, you got to kind of be an ally and we're doing this together, or there's some things we have to change in that, right? So it was good for him too.
Yeah. What would you say to someone who is considering working with me?
I would say at least try it. Like I said initially, I didn't really feel like I had the need. By most people's account, they'd say, oh, she's doing well, she doesn't need that. But when you get into it, you find that this is really support. And just because something is good or good enough doesn't mean that your experience can't be better.
I like that. Not because something is good or good enough, it doesn't mean your experience cannot be better. And the truth is, too often we settle for good or good enough, forgetting that we're always called to go up higher. Because I think as Christians, because you mentioned the Christianity piece earlier, there's always more, with God. There's always growth, which means there's always more. It doesn't have to be like a big flame, a big burst. It could be gradual, but to know that we're progressing, because if we're not progressing, we're stagnating. And when we're stagnating, we're putrefying. I always remember this is going to go way back. And I mean, it's kind of tangential, but I like my tangents. But my father was a pastor. And I remember one of his sermons, I don't remember many of them. Your father's preaching, and sometimes you're there, and sometimes you're not quite there. But I remember one of them, he used the image of stand, because in Guyana, we have a lot of water. We say a lot of drains, ditches, canals, all kinds of things. And it's flat, so you have to have your drainage. So he talked about what happens when what we call the trench. The water stagnates, and it backs up, and you get that stink smell, right? Because things are now moving, putrefying. So that's not what we want for ourselves. We want to grow. Sorry, it's just a memory, very random, but it
Visual.
came to me when we were talking. So yeah, so I appreciate that. I appreciate having you as a client, because I learn from all my clients, and I'm learning some things from you as we go along. And if you were to sum up your experience in one sentence, a single phrase, not necessarily a sentence, to sum up your experience and results from working with me, what would it be?
Just the sessions with Dr. Smith leave me thinking about what's next. And sometimes the what's next is hang out here, cultivate this. And sometimes it's something else, but it's that not feeling stifled, not feeling stifled.
Yeah. Stifled, you said?
Yes.
Okay, great. So thank you again for chatting with me and sharing with me and others what it's been like working with me, and look forward to our ongoing coaching relationship and other relationship, because we're friends outside of that. And just wish you all the best in your endeavors. I know you're very passionate about what you do, about the well-being of others. So pray God's blessings on you.
Thank you,
Bye,
Dr.
Rachel.
Thank you.
You're welcome. Bye bye.